Welcome, Dr. Karyl Rattay. You've been so gracious in coming on periodically to keep us updated. How are you?
I am fine. I am fine. It's been a rough winter for many people for sure, but happy to be here with you. Thank you for the invitation.
My pleasure. Now, the first question, the big question is it still important that everyone be vaccinated?
Absolutely. The more people that can get vaccinated, the more we are able to control this virus. And we use a term called herd immunity, which at the low level is 70%. So we need to get at least 70% of Delawareans vaccinated to really begin to squash down this infection. But more is better for sure. I mean, if we could get above 95%, we would be in great shape.
And I've heard a lot of chatter, of course, on social media. Um, Even one person who said, well, if I get vaccinated now, what if there are variants that come along? And what if I'm exposed to one of those? How would you respond?
Yeah, so it really is a great question because we are seeing variants, and the two primary vaccines out there right now, Pfizer and Moderna, are showing some pretty good effectiveness against the variants. A little bit less so with the South African one, and viruses mutate, they change, and so it is possible that just like annual flu vaccines, we may need to be doing annual COVID vaccines as we move forward, as the viruses mutate. So, I mean, it is a great question. It may be our reality, but right now, what's important to know is that the Moderna and the Pfizer and even the Johnson and Johnson, what's known, have some effectiveness against these variants, some good effectiveness, and so still important to get the first vaccine available to you.
Sure. And I'll just throw this question in. Will the J&J be coming to Delaware and when?
Yeah,
Any idea?
we are so excited about the J&J and having a new vaccine in the mix for several reasons. More vaccine means more people can get vaccinated more quickly. But also the one dose vaccine is a preference for many people. It's easier to get one vaccine and then to be told that you're pretty much fully vaccinated 2 weeks after. So we are anxiously awaiting right now confirmation, but we should be receiving some of the J&J vaccine this week here in Delaware.
Great. Now we're still in the rollout phase. That's essential workers and plus 65. Is that correct?
Yeah, so we're in what's called phase 1B. So phase 1A was healthcare workers, first responders, long-term care residents and staff. Most of those folks have been vaccinated. Some didn't choose to yet, so they can still get vaccinated. But 1B is where we are right now. We're really focused on those who are 65 and older. Really with a focus, especially with the variants, we want to get vaccine into those most vulnerable to hospitalization and death sooner versus later. But we're also now beginning to be able to do more rollout of the critical workforce in 1B, which includes teachers and childcare providers. And there's others as well, like poultry plant workers, others in the manufacturing jobs as well. So we're going to continue over these coming weeks to get more vaccine into our seniors as well as those other critical 1B workforce.
Okay. Couple of questions then on the vaccines. Is there any difference between Pfizer and Moderna? Can you choose when you sign up to be vaccinated which one you're going to receive?
So the way logistically the vaccination rollout really needs to be is one vaccine at one location. It's just too complicated to have more than one vaccine type at one location. That being said, we feel it's important that the public is informed about the vaccines and aware of what vaccines being offered at a site. That being said, they are all great vaccines. They all are far exceeding they are all far exceeding our expectations around these vaccines. We were hoping for 50% efficacy. Pfizer and Moderna, 94%.
Wow.
Johnson & Johnson, 72%, although all of them are 100% effective against hospitalization and death, which is amazing. And so, again, they're all great vaccines. And our recommendation is just get the first vaccine that's available to you when your number comes up.
And I'm going to be the devil's advocate here today, just throwing out things that I've heard again out in the digital universe. Is it really necessary to get both shots?
Yeah, great question. And there's been a lot of controversy over that. A lot of questions. We've had many discussions. Should we just try to get the first doses into as many people as possible and skip the second dose for now? But here's the thing. The first dose for Pfizer and Moderna is, somewhere around 70, 80% effective. That second dose, just the way these vaccines are produced, that second dose is what really stimulates the immune response and gets it up to 94%. And what we don't know right now is if you hold off on that second dose for 3-4 months, will it make a big difference? And because we don't know, we're really doing all we can to promote that second dose within the FDA recommended time, which is either 21 days for Pfizer or 28 days for Moderna. But that being said, if it doesn't happen, within 42 days of a first dose, it's fine. We're not seeing negative effects, but we're waiting for more science. If the science says, you can spread it out several months and let's get everyone first doses first, we'll go that route. But that's not what we know to be true right now.
Sure. Now, I do know someone who received a second dose, a teacher, who then had quite a high fever, aches and pains, but just for one day, and then was fine. Can you talk about that?
Yeah, I thank you for asking that, because I do think it's important for people to know you will likely have some side effect from this. They're minor. A lot of people they get a sore arm. About 70% of people get a sore arm.
And by the way, if I may interrupt, that's the body responding, right? The immune system.
It is. So the sore arm isn't just because a shot went into your muscle. The sore arm is because that's where your body's immune reaction is happening, and at least to start with. And so that's a good sign. Now, if you don't get a sore arm, or you don't feel, you don't have a fever and you don't feel under the weather, that doesn't mean you're not having a good response. But those experiences of side effects, some people get headache, many people feel fatigued, just tired the day after. So what I recommend is just expect, especially when you get the second dose, expect that you may feel under the weather the day after, and just try to plan accordingly. A lot of people will say, they'll just plan for a Netflix binging day the day after if they feel great.
Gee, that's new.
Great. Yeah. And also Tylenol and Motrin, you don't want to take it beforehand. There's, some question of could that blunt the immune reaction? Not really clear, but don't take it before you get your vaccine. But if you get some side effects after your vaccine, go ahead and take Tylenol and Motrin. It's fine. And that will make you feel better. But don't worry about the side effects. That's nothing to be concerned about.
Okay, just 2 more questions for you, because I know you're extremely busy. What about registration? I personally am signed up with the state and Walgreens and Giant Foods and waiting because I got tips about Walgreens and the supermarket again on social media. But where should folks sign up?
Yeah, I mean, you did the right thing, Sharon. Sign up on the multiple registration list. We have a wait list that has 123 thousand individuals on it. At this point, we still have not been able to offer vaccine to more than half of the individuals on that wait list. You know, where you get that first invitation is going to vary depending on who's got vaccine at that time.
Well, I think, may I interrupt? What's confusing to people is why would they need to go to other sources if the state really is the central distribution pipeline?
Yeah, so it's a great question. So the wait list that we have created is really for the state-run vaccination events and sites. That includes the events that we run, as well as we have curative events, we have vault events, we have other partners where we will take individuals from the wait list and say, can you please contact them? But you know, every pharmacy has their own approach, you know, national systems that were created. And we decided that it just kind of like the testing work that we're doing,
Sure.
it doesn't make sense to put it all under one umbrella. It really, you know, let's let the marketplace, you know, continue as is. I also will add that some of what a lot of people experienced is, you know, the last 2 weeks we've been giving a lot of second doses. So while we've been focusing on second doses, most people who've been on these various wait lists haven't seen a lot of movement. That's going to change now that we're kind of over the second dose hump. And so hopefully many people in the next 2 weeks on the wait lists are going to get probably one or more invitations to get vaccinated.
Fantastic. And final question, Karyl. After someone receives their 2 shots, is it still necessary to wear your mask, wash your hands, keep your distance? Can you visit with friends, go out to lunch if anybody is serving lunch?
Yeah, thank you for that question as well. And I think we're all eager for the day that we get more science that says, here's the things that you can do now. You can let your guard down a little once you're fully vaccinated, plus 2 weeks. But right now, we have still high levels of virus in the community. And so what we know from the science at this point to best all do our part to prevent spread, transmission of the virus, that we should continue with the mask wearing, which is likely to continue for till the end of this calendar year. We still should social distance. Can you let your guard down a little bit? I think probably a little bit,
You know,
meaning
I just don't get these mask wearing people. I mean, what is the big deal? I think I'll probably wear a mask on an airplane flight for the rest of my life now that I know how this spreads. But it's so simple, and I think it's a civic duty in addition to protecting oneself.
yeah, it really is so easy. And I think, you know, I think about my kids and all of our kids and how they just don't care. They wear masks. They never complain. I've seen both of my children wearing masks fully while wearing sports. They don't care. It's the easiest thing in the world to do. And I agree with you. Now that we know how easy it is and how effective it is in preventing the
So
spread of
simple.
infection, like flu this season, we have almost no flu cases, and mask wearing is a huge part of that. So I hope that that becomes a little bit of our norm going forward in preventing all kinds of infectious spread.
Absolutely my norm, and I think really everybody I personally know. Dr. Karyl Rattay, so kind of you to make the time, and I will keep bugging you periodically to stay, in the know here. as we proceed with this. Do take care.
Thank you. Always a pleasure, Sharon. Appreciate it.
Thank you very much.